Up to 70 million Americans have a sleep disorder, and sleep apnea is one of the most common. Dr. Richard Chaffoo is here to explain. Dr. Chaffoo, good morning to you.
Good morning.
Did you have a good night's sleep?
I did.
Okay. That's good.
I'm not tired, so I'm fine.
Okay, that's good. That's good to know. So let's talk about sleep apnea. We hear this a lot.
Yes.
How many people would you say in the U.S. has sleep apnea?
You know, I would say it's probably anywhere from 3 to 5% of men. And a slightly smaller percent of women, but there's up to 50 million people in the U.S. that have some sort of sleep disorder. And of course, snoring being a common one, but sleep apnea being the more serious of those.
Okay, there's a big difference. Sometimes people hear snoring and they think it's just snoring. But it turns out it could actually be sleep apnea.
Exactly. It can very early, and that's usually the very first symptom that will be noticed by one's partner is that they hear the snoring, they wake up and they watch them, and they actually notice that there's a cessation of breathing for a different period of time. You know, for mild sleep apnea, it may only occur a few times a night, but for people that have serious sleep apnea, Kristina, it can be literally hundreds of times a night that you're waking up from sleep. And the problem with that is that we sleep researchers tell us that what we need the most of is that REM sleep, that sleep that gets us into very deep. And unfortunately, when we have sleep apnea, we never get into that REM sleep. We don't get deep enough, and so we wake up being very tired, very fatigued, headaches, somnolence, very serious symptoms if it's maintained long term.
You know, and I remember growing up, my dad always snored. Sorry, Dad, I'm telling your story. He always snored, and you know, we just knew that. But then it got to the point many years later that my mom would say she felt like he would stop breathing, and she would wake up because she understood the rhythm already of his snoring. And when he would stop, she would get nervous, and she would try to do this to his chest, like, "Oh, I need you to wake up." And he would come to, and it was just. But now he's got the CPAP machine that he uses and all that stuff. So, it can be. It could be serious, so it's something that you want to catch.
Yeah, exactly. You know, people, there are all sorts of jokes about snoring, and snoring in and of itself is not serious, but you're right, it can be the very first signal that there's something serious going on with our respiratory tract.
So what are we looking for?
So what we're looking for primarily is just what you said about your dad, is essentially we're having problems being very tired the next day. And it's important the observer, who's observing this and notices it. Hypertension is a very common factor as well. People that tend to be overweight or have high BMIs. And then our age. Unfortunately, over the age of 50, it's more common as we get older, unlike a lot of illnesses. And then another thing is the neck. A larger neck, a heavier neck. Those people, the airways tend to collapse more, during that period of time. And then the gender, unfortunately, it's more common in men than in women, but certainly it can occur in women. So you really want to look for those signs or symptoms that may be very mild early on in sleep apnea. Maybe they're just a little tired in the morning. Maybe you're having some headaches, a little bit of fatigue. But with untreated and unchecked sleep apnea, those symptoms will continue to get worse and worse to where literally people will fall asleep driving a car or operating dangerous equipment. Can have serious consequences, uncontrolled hypertension, stroke, so very serious ultimate consequences of untreated sleep apnea. And the big thing, of course, is CPAP. That's been a lifesaver for patients for sure.
Okay, so say that you find out you have a mild case of sleep apnea or what have you. What are some of the treatments that we're looking at?
So the treatments are, and just to back up a moment, the gold standard is really get a sleep study. So if you're concerned about that, see your primary care doctor and get a sleep study. But the most positive thing about this is, the other things besides CPAP are obvious things like losing weight if you're overweight. There may be times where positional therapy, tend to lie more on your side versus directly on your back. And then there are surgical procedures that are sort of a last resort that can be done to open up the airway. But most of the time, CPAP can literally change patients' lives dramatically.
Absolutely. And so I understood what sleep apnea was, but I didn't realize, like what you just said, that it could be so severe that people are falling asleep as they're driving because they're that exhausted.
Right, exactly.
And
and that's the lack of REM sleep. Researchers tell us that if you're not getting into that deep level of REM sleep, you're not getting that rest that your brain needs, and so that's going to show itself the next day. And long term, you're going to be so fatigued during the day that you can't do your normal activities.
Well, there we go. I just learned something new. I'm going to go home and tell my dad, this is what I learned about your sleep apnea. Dr. Chaffoo, thank you so much for your time.
Good to see you. It's my pleasure.
All right, and I hope you have a good night's sleep tonight.
Thank you.